Having sex 30 times a week averages roughly 4 to 5 times every day. While it is technically possible for young, high libido couples during brief periods, like a honeymoon, maintaining this extreme frequency quickly introduces significant physical, emotional, and practical challenges. Physical and medical effects: severe tissue friction and damage. The human body, particularly delicate mucosal tissues, is not designed for constant, heavy friction without rest. Even with copious amounts of lubricant, having sex 4 to 5 times daily will almost certainly cause severe skin irritation, raw chafing, swelling, and micro tears on both the penis and vaginal walls. High risk of UTIs and infections. For women, continuous intercourse repeatedly pushes external bacteria toward the urethra, drastically increasing the risk of painful urinary tract infections, UTIs, or severe honeymoon cystitis. Extreme fatigue and muscle exhaustion. Sex is physical exercise. Engaging in it multiple times a day uses substantial energy and leads to chronic physical exhaustion, muscle aches, especially in the lower back, hips and core, and fatigue that can interfere with work and daily life. Temporary nerve desensitization. Repeated orgasms within short windows temporarily drain neurochemical reserves and desensitize nerve endings in the genitals, making subsequent erections or climaxes difficult, painful, or impossible to achieve. Temporary sperm depletion. For men, ejaculating multiple times a day completely depletes the epididymal storage of sperm, while harmless long-term individual ejaculates will consist almost entirely of prostatic fluid with near-zero sperm count. Emotional and relationship impact. High risk of burnout. Treating intimacy as a daily endurance test quickly turns sex from an enjoyable connection into an exhausting chore or obsession. Resentment and duty sex. It is extremely rare for both partners to naturally maintain a desire for sex 4 to 5 times every single day. If one spouse participates purely out of pressure or obligation, it creates severe emotional distress, anxiety, and long-term resentment. Neglect of daily responsibilities. Sex 30 times a week consumes hours of the day, making it nearly impossible to maintain a normal work schedule, household duties, family life, or proper sleep patterns. Essential precautions if experiencing extremely high frequency. Stop immediately if pain occurs. Sharp pain, burning during urination, bleeding, or severe soreness are clear signals from the body to take a break for several days. Use heavy lubrication and practice hygiene. Generous water-based lubricant and washing before/after are critical to reduce friction and lower infection risks. Prioritize communication. Ensure both partners are giving 100% enthusiastic consent and aren't feeling pressured, physically drained, or emotionally overwhelmed. If the urge to engage in sex 30 times a week is driven by compulsive feelings, stress avoidance, or an inability to control sexual impulses, rather than mutual enjoyment, it may be beneficial to consult a healthcare provider or relationship counselor.